Welcome to GEMS Podcast with Genesis Amaris Kent. With me today is Mike Montgomery, and here's a bit about Mike. He offers small business benefits. He saves entrepreneurs and small businesses 30% on health insurance while creating tax deductions. Who doesn't like tax deductions, right? Open enrollment ends January 15th this year. So make sure you have the necessary coverage for you and your loved ones. And with that being said, Mike and I today are going to talk about private health insurance. Why is it important? How he could help you tap into that, and why you could take the tax deductions that you're saving and diversify it and put that money elsewhere so you could build that generational wealth for you and your family. And without further ado, I want to welcome Mike Montgomery to GEMS Podcast.
Thank you. Thank you for welcoming me. Happy to see you. I love the office background there. I feel so professional right now. Excuse mine, we're having a baby, so things are a bit hectic, but I'm thankful for being here. But I'm Health Unicorn Mike. That's what everybody calls me. I'm a nationally licensed, award-winning health insurance broker. As you mentioned, I do offer affordable health coverage that creates tax deductions for small businesses. I've actually been in the industry for 9 years. I was a financial advisor before that. I'm licensed in 33 different states and have access to 95% of the plans available. So look forward to the conversation.
That is amazing. And Mike, how did they dub you Health Unicorn Mike? What's the...
My wife, actually. My wife has her own marketing agency. And what's interesting, I had a client, I was telling her all the things that I can do with insurance. She was like, wow, if you can do that, you're a unicorn, right? And I was like, oh, maybe I am a unicorn. And then my daughter loves unicorns. So I put a little unicorn on my head. And my wife, who's got the branding eye, said, oh, that's a thing. And it became Health Unicorn Mike. But the reason I'm a unicorn is because a couple of things. I'm Black, Jewish, and from Alaska, right? And then probably another way I'm a unicorn is that there's only 4,000 people in the entire country that have access to what I have access to. Of those 4,000, I was number 18 in the country last week. So yeah, I'm a unicorn.
Wow, incredible. And then based on you being number 18 in the country, how did you acquire that metric and get up to being ranked number 18 and being one of the 4 people that offers what you do?
One of the 4,000.
Oh, one of the 4,000. Thank you.
Yeah, well, I went to college, I went to undergrad, Norfolk State University, behold, right? And then I went to Auburn for my double master's. And I got a full ride, kind of went along that path. And I realized really quickly that I was in school for the wrong thing. I was almost done. I was about 6 classes from finishing, and I guess got burnt out. I was like, oh my goodness, I can't do it for a second longer. And I decided to go get a job. And I was like, let me go get experience in my field, so I can know what I'm doing. And come to find out, the experience I got made me hate the field completely. So now I've dismissed the degree, and I got into sales, got recruited to be a financial advisor. And then I realized that I didn't like the life conversation. I liked the health conversation. And that was all she wrote. I've been health insurance ever since, and I'm very passionate about it. And I really love it.
Now let's really unpack health insurance, because I actually just did an IG live today with someone who is now an anti-financial advisor, because he said a lot of the financial advisors that he knows are not debt-free. They sell a bunch of stuff. They don't have different avenues of, just being able to just walk away if they wanted to, because they're so busy trying to sell so they could reap that commission and bonus. So we talked about passive income. And now I'm kind of hearing something similar with you. You didn't really like the financial advisor side of things. You like the health side of things, which is so important, especially depending on where you live in the world. Healthcare insurance by yourself is very expensive. And that's why some people are afraid to leave their 9-to-5 jobs, because they know, okay, if I leave this job, benefits by myself is really pricey. But that's where you come in, because you're like, hey, I help small business owners get affordable private health insurance, which is the same amount of health insurance coverage that they would have if they were in the quote unquote e-bucket, the employee bucket. And then you get a tax deduction. So it's like you're paying for it, but you're also getting the ability to write it off on the back end. Did I kind of sum that up right? Because I know you're the
relatively. So in essence, when it comes to health insurance, kind of diving in, right? So there's 3 ways to get full coverage in the United States of America. The first option is an employer/group coverage. That's what you just mentioned. That's actually only applicable for those that have over 50 employees. If you have under 50 employees, then things are actually going to be done on an individual basis. When you do things on an individual basis, then there's actually only two ways to get full coverage in the United States of America. The first option is a public option. Um, the second one's a private. Now, a public option is an income-based option. It's designed for those that make typically under 34 to, let's say, $42,000 a year, or those that have chronic health conditions. Chronic is something over 6 months. If you don't fit into either of those categories and you go that route, then you pay more money out of your pocket, as much as a 400% increase. That's where the expensive aspect comes in at. Well, that's what Obamacare is. Those are income-based plans. The alternative to that, especially if you're 1099, you're self-employed, you have a small business, is to instead go with a private option. A private option is a health-based option. So the long and the short, if you can pass 10 to 15 medical questions, I can save you about 30%, right? Now, the quick reason that that disparity exists is because when Obama took office, he took on what's called the Affordable Care Act, right? Everybody knows about, they call it Obamacare, but it's known as the Affordable Care Act. What that actually meant was that before Obama, every single company out there did underwriting, right? It means they had to answer medical questions in order to get coverage. Well, after Obama took office, he eliminated the medical questions there, so people that had chronic conditions could get coverage. And he also eliminated the financial requirement, so those that were insolvent could get coverage. So those in the middle ended up paying a lot more money than they were paying before because of that. So that's what beget the private options there.
Wow. Yeah, because I know a lot of people were saying that the Affordable Care Act, it was not very affordable. I even looked at that whenever I had got laid off from my Fortune 500 oil and gas job. And I was like, oh my gosh, these prices are astronomical. Like I've never paid this amount because I always had employer coverage insurance. And then now that I'm in the entrepreneurship bucket, it's like, oh wow, okay, let me really start looking out. So you're actually in a really good spot, Mike, to help so many individuals. So can you really walk us through like the breakdown? Like, for example, if a client came to you and they're interested in private health insurance, but maybe they can't pass like all of the questions, what can they do to make sure that they are getting insurance at an affordable rate while also recouping on the back end?
Okay. So typically the medical questions aren't usually that complicated. They're not like expecting you to be like an Olympian per se, you know? Um, right, you know? What's funny is that you do things in underwriting such as like BMI, which is like body mass index, right? And even like a bodybuilder's like, you know, cut, super fit, works out every day. They maybe have difficult getting a health-based option because they have so much muscle mass, and muscle weighs more than fat. They have so much muscle mass that from the scale that they're looking at, it looks like they're overweight or they're obese, but they have 2% body fat, you know? So it's, you know, different situations for that. But it kind of really depends. So when you're narrowing it down, again, if you're over 50 employees, you're going to deal with the employer group coverage. The rules are entirely different. That's what a lot of people don't realize is that the reason we think that, hey, group insurance is so much less is because your employer is covering 50% of the cost of the insurance. By federal law, if you have over 50 employees, you have to, right? So when you're going out on your own, that 50% share of cost is taken away. And then on top of that, the network is your biggest thing, right? So what you really want to do is get yourself a PPO if you can. With most plans at your job, you don't even have a PPO. You typically have an HMO. Those are like county specific. It doesn't travel with you nationwide. I don't know if that necessarily answered your question per se, but I think that's my answer there. Or we can
Yes,
dive more into it.
it does answer my question, and I'll just put some context around it because when I was working for this oil and gas company, I had PPO, which gave me the ability to go to whatever doctor I wanted to go to. Whereas HMO, there is one doctor, which is your PCP, your primary care physician, and that PCP has to refer you to different specialists. And some people don't like to have to go to one doctor to be referred to a different specialist. They want to be able to do that on their free will because sometimes if you don't like your doctor, then you should have the ability to change that doctor. And Mike, that did answer the question, and I just wanted to break that down because some people may not necessarily know the true difference between PPO and HMO. And since I'm not a SME like you, can you break it down further?
Yes, yes, absolutely. So what you said is pretty spot on. PPO lets you see any doctor. HMO has requires within its prior authorizations or referrals. More specifically, a PPO stands for a preferred provider organization. It, the real reason that your network matters. So I always talk about this in Clubhouse. I say your network is your net worth, right? And in your insurance space, it's very specific. So it's a very direct indicator there. There's actually 5 networks. People don't really realize that, but there's actually 5 networks that you commonly may see, right? So from the bottom to the top, just so we can be on the same page, you have your PFFS, right, which is a point for service system. You have your POS, which is for point of sales or point of service. Then you have your EPO, exclusive provider organization, your HMO, health maintenance organization, and then your PPO, a granddaddy of them all, the preferred provider organization. So what those networks really mean, though, is they actually mean percentage discounts, right? So it's going to go into depth as you asked me to. Let's say hypothetically that you had to file a claim and your claim was $10,000, 10,000 just as a usual aggregate, pretty common claim there, right? To be honest with you, 86% of all claims are actually under $10,000 because 86% of all claims are based upon accident. But that's just a random nugget for your room. But to kind of put it in perspective, 10,000, right? So we won't go through all 5, but just for the sake of conversation, PFFS only covers about 0 to 10% in regards to your network discount. So if you had a $10,000 surgery, they're going to cover $1,000, and then they're going to give you a line item benefit of probably an additional, let's say, $250. So that PFFS, because you chose that plan, you'd be coming out of your pocket on a $10,000 procedure, somewhere in the ballpark of $8,000 because of the network that you chose versus a PPO. Go ahead.
So question there really quick, because PFFS and then POS, I've seen POS where it has POS 1 and POS 2. And
Okay.
then based on the other ones that you mentioned, whenever you get into those 5 categories, whenever you come to break it down, who breaks it down? Is it the employer, if it's an employer coverage, or if you're in the private side, do you have the ability to break it down per the people that you are covering it for?
Rephrase your question when you say break it down. What are you referring to?
So for example, whenever I was with XYZ company in oil and gas, I had PPO, but then I had the option to choose between POS 1 and POS 2. But then you mentioned that there's 5 different categories. So who selects the 5 different categories if you don't
Okay.
see all the options?
Okay. Let me kind of rephrase that. So what you were dealing with before was an employer plan. Employer
Yes.
plans are going to operate entirely different than the individual market.
Okay.
So in regards to even how they're structured, for example, because they'll say a PPO, but if they're saying a POS as well, those are 2 different networks. So it's going to be 2 different things. Go ahead.
Okay, so then, now, oh, thank you so much for explaining that. So then if you remove the employer coverage program and you use the 5 categories that you're talking about, are those 5 categories available if you have private health insurance, if you want to look at
That's what you're
those?
asking. Okay.
Okay.
Potentially. I'll put it into perspective. Not all plans are available in all areas. That's the thing that a lot of people don't know. And a lot of the factors, there are different factors that go into your price and what's available. So for example, if you deal with Obamacare, just going to give you a reference there. So first 5 networks: PFFS, POS, EPO, HMO, PPO. You would go on a website like healthcare.gov, right, or healthsherpa.com, and you'd be able to shop your Obamacare options. That's where the public marketplaces exist at. And you would say, all right, I think I want this, because you don't speak the language. So you just, kind of throw a dart at the dartboard, right? Hopefully it works out, right? Typically it doesn't, because actually 69% of all bankruptcy in the United States is due to medical debt. And that's pre-COVID. And that's because people pick themselves the wrong plan. So they don't realize these percentages that I'm talking to you about. So what they do is they get themselves a PFFS, which only covers about 15% of the cost if something happens, or they get themselves a POS, which only covers 20% of the cost. They get themselves an EPO, which covers 35% of the cost. They get themselves an HMO, sorry, which covers 50% of the cost, or they get themselves the best plan, which would be a PPO, a health-based PPO is going to be the best option to get. And that's going to give you a 60 to 80% in network discount along with a line item benefit. So in that same example, the 10,000 we talked about, the PFFS versus PPO, if you chose a PFFS, you're coming out of pocket $8,000 for a $10,000 procedure. If you chose a PPO, a health-based PPO like what I'm talking about, that same $10,000 procedure could cost you as low as $100, or realistically, just from the sake of simple math, it will probably cost you about $400 compared to the $8,000 you would have paid on the PFFS. So the network is literally your net worth there.